Ramelchuk, and I'm the Program Manager for the National Genetics Education and Consumer Network, or NGECN, here at Genetic Alliance. This webinar, Resources on Access, Support, and Advocacy in the Health and Insurance World, is an activity of the NGECN, which is part of the National Coordinating Center for Regional Genetics Services Collaborative, and it's funded by the Health Resources and Services Administration, HRSA. I'm excited to introduce this webinar as it is the last part in a three-part series on empowering individuals and families as advocates in conjunction with the launch of the Advocacy ATLAS. Over the past year, Genetic Alliance has worked with Parent to Parent USA and Family Voices to create the Atlas, a resource that provides quality, accessible tools on leadership and advocacy and empowers individuals and families to advocate. We designed this resource knowing that every day families have to advocate for the things they may need and want, especially if there's additional steps, challenges, or barriers because of special health care needs. Our partnership with Parent to Parent USA and Family Voices has been extremely valuable. We share many of the same objectives, and by combining our forces, we're able to reach and empower an even larger network of individuals and families. I invite you to check out the Advocacy Atlas as well as the 2 other recorded webinars, which are available on Genetic Alliance's website and our YouTube channel. And you'll love to hear the stories about some great resources and from some self and parent advocates on how advocacy has been a part of their lives on getting access, services, and supports. Just a few housekeeping items. Your lines are muted today, so if you have a question, please type it in using the chat box feature in the webinar panel. We'll take a few moments at the end to answer any questions we've received. Also, we are recording the webinar today, and it will be archived following the webinar. So here, I'll begin by showing the Advocacy Atlas and point out some of the key features, including how to access resources, and then I'll pass it over to our guest speakers, who will talk about some of the topic areas featured on the Atlas and the particular importance the topic areas have to them. The Advocacy Atlas can be accessed at www.geneticalliance.org/advocacy-atlas. Here you see the homepage depicting a winding road. I like to think of it as a journey of advocacy. We have separated the resources into 10 different topic areas. In each of the topic areas, we feature a personal story from a self or family advocate and some pictures submitted by families. This is my favorite part of the site. I think it makes it real, and it reinforces the fact that advocacy is a real part of people's lives, and each person has a unique story to tell. So if you click here on Accessible Communities, I'll show you what a page looks like. Here you can see each of the resources listed by title, followed by the authoring organizations. We know there are so many great resources out there being developed by dedicated organizations, and our goal is really to create a place out there where resources are accessible in one spot for families to be able to find what they are looking for. All the resources are direct links, so you're not brought to another website and then continue searching for the resources you're looking for. You go directly to that resource. And also at the bottom of the page is a link to return to the home page. Going back to the home page, there's a few additional items I'd like to point out. Below the map is a button where individuals can share feedback, especially if you have additional resources to add. We want to ensure that this tool continues to be useful and comprehensive with quality tools for families. Also below the map, there's a button asking for feedback, and we encourage you to give as much feedback as possible so we can continue to grow and make the site better. The next portion of the presentation, we will have guest speakers to first share their story about advocating and the skills they've developed, and then highlight many of the resources found in the Advocacy Atlas. Today we'll be featuring our first speaker, Rylan Rogers, who has many roles, among which she is the Training Director and Family Leadership Coordinator at the Riley Child Development Center, as well as the Director of Family Voices in Indiana. So without further ado, I'd like to introduce Rylan. Rylan?
Hello, and thanks for spending some time with us this afternoon talking about one of my personal passions, advocacy, and the role that families can have in it. From your slide, you can see how I got into this current position. I am the mom of 2 teenagers. My son Matthew is 16 and my daughter Laura is 13. Both of my children have mitochondrial disorders, which is a form of muscular dystrophy, and in their case it impacts them in a wide variety of ways and has led them to be pretty medically complicated throughout their lives. As was stated, currently I have several roles. I'm here in Indiana, working in this middle part of our state in Indianapolis at our children's hospital, where I'm part of the Riley Child Development Center, which is Indiana's LEND. I came to this position as a family leader and then have grown into the position of training director. My personal passion is family leadership and healthcare financing, and that dedicates and dictates my volunteer activities, which in Indiana is as a leader of Family Voices, which is our state's family-to-family health information center. There's one of these organizations in each state, and we exist to support families in navigating healthcare financing for their children. And it was in becoming a mom 16 years ago that led me to a crash course and on-the-job training around healthcare financing and advocacy. And I'm going to share a bit about the lessons learned and how the tools that are available on the Advocacy Atlas could have helped me and can help families moving forward. Next slide, please. Early on in my experience, I learned many things too late. Without a diagnosis that would have quickly connected us to existing advocacy communities, I felt like I had lots of pieces and nothing fitting together. Unfortunately, we were income eligible for some programs, but were told that they didn't apply for, or they weren't accessible to us, and we just were a family that fell through the cracks. And I believe that's one of the pieces that these kinds of tools can help avoid for other families. Today I'm going to focus on how my personal advocacy and our family level focused on healthcare financing and access to insurance, and then how I've moved that forward on other pieces. This tool provides key resources, and some of them really would have changed the path for my family. Next slide, please. When Matthew was born 16 years ago, my husband was a public school teacher, as was I. At that time, I was planning to leave teaching and be a stay-at-home mom. When he was born, he was very medically complicated, but there wasn't a clear diagnosis. He actually fully arrested at 24 hours old, and we knew there were going to be very serious consequences. We were initially told that we were over income for everything. It turned out that wasn't entirely accurate, as we were eligible for the Children's Special Health Care Program, and later found that out from another family. But private insurance was our primary access to care, and what I quickly became aware of is that you didn't really understand insurance until you had to use it. And when I understood that using it meant actively participating in the appeals process, I quickly knew that I could have a great impact on what our actual out-of-pocket expenses were. One of our initial early investments that still pays off to this day was a used fax machine. I quickly learned how to write an insurance appeal, and then how to get it to the right place, and often resend it several times, and that those various actions would allow me to meet my family's needs in a more appropriate way. Over time, I joked that I was really earning a pretty high hourly rate by these kinds of activities because I was driving down our out-of-pocket medical expenses. I was also really quickly aware that there were many, many programs out there, and it was very difficult to understand how the eligibility worked for each one of them. The key resources for us were other families, but I knew that there were ways to pull those pieces together. That's led to my passion around Family Voices. But that led me to understand that it wasn't always going to be a one-size-fits-all answer. And we really had to look at what are the ways to pull different resources together. So I think it was that understanding of insurance, understanding what your coverage is, understanding and using the appeals process, and understanding how relationships can matter. One of the pieces around advocacy for your own children and healthcare financing advocacy is that in some cases it really is about relationships. There were several examples of that in my family story. Our private insurance came through my husband's employer, and we did in fact cap the lifetime maximum, which thankfully no longer exists after January of this year. But at the time, our son capped his lifetime maximum early on. But the employer decided, because of the relationship and that they valued my husband, that they would change their insurance plan so we could start the maximum cap again. Knowing that that had happened to me helped me help other families understand about that it's at least worth asking about if that was possible. The other piece where relationship came into play was understanding who at the human resource side of the business could help with insurance appeals. When it was time to get the diagnosis of mitochondrial disease, at that point the only way to do it was at an out-of-state site with a muscle biopsy, something that wasn't covered under our conventional insurance plan. But having done all of the research about how this was the next best step, and having the documentation from our medical team, and a relationship with a human resources person allowed me to present it to them, and they were able to allow us to have that coverage even though it was beyond the regular scope. So there are pieces of insurance navigation that are different than just letters and appeals. Those are key parts, but there's also the piece about relationship. And all of those were lessons that I learned on the job. The nice thing about the Advocacy Atlas, next step, next slide please, is that there are tools to help you learn those things right now as you're starting out. There are great examples of writing insurance appeals letters. And it's always helpful to look at examples of what other people have done so that you can reframe them and write them in a way that works for your family. There's also great ideas about how to navigate and organize some of the things that you need to build those relationships and get the things in place for your child. And while this is a national resource, there are connections to local resources that can help you understand what the eligibility may be in your state. Next slide, please. As my family grew, it was clear that there were other individuals like us that had this lifetime of complex care. I became aware that about what didn't work and what I could do to fix it. I was almost instantly engaged in what came to be my life's work. I wanted to think about how the systems and services could be better for the families that came behind me. Initially, that was in a first step system looking at, which is our early intervention system in our state, was looking at income levels. And my family was the great story for that. How a middle class, and really a lower middle class family's income could prevent us from accessing some critical early intervention services, and how that was actually economically detrimental in the long term for our state's bigger picture. Shortly after we got out of First Steps, I was on to school accessibility and looking at some of the federal regulations and how we could make our own school system, their transportation, and even their buildings accessible for our children. Then it was about getting RN level of service at school, and from there it's gone into helping the Medicaid system and those pieces. I think it's really about figuring out where your story has an impact beyond your family. What are the things that you care about and you know could be different or better for the next person coming behind you? And where are the opportunities to partner with other families who are having similar experiences and similar frustration? I quickly became aware that families had a voice and that our voice was unbelievably powerful and that we had expertise that our policymakers had no way of accessing. Back to my early learning on an individual basis that most people have no idea about how their private insurance works, most of our policymakers had no idea how these large programs worked. And we could share that information and make a huge difference. So I got engaged at advocacy at the local and state level. And it took some trial and error and connections. But again, this tool allows us to look at some opportunities. So next slide, please. I love that in Access to Healthcare, one of the advocacy tip sheets is from CASA, Kids as Self-Advocates. And the thing I love about that most is some of the primary lessons I've learned about effective policy advocacy at the state level have come both from other families and from self-advocates. So looking at those who have come before us who can mentor us in that and the tools that exist is a really key part of building our advocacy skills and our story. Next slide, please. advocating doesn't have to stop at your local community level. It really can be beyond that. And what I think we have to offer, and what I like to offer, is really advocating at all levels. And sometimes it's about a particular policy or program or funding, but a lot of times it's about a philosophy. It's about making sure that our families and our stories are part of our national, local, and even regional dialogue. I want people to know that families like mine have much to offer in this world, and that the systems and services that serve us serve all of our communities. So by raising those issues, we have the opportunity to do that. I, over the years, have had a wide variety of opportunities, mostly because I was willing to say yes. And there are lots of ways to do this. So I've been lucky enough to be able to travel to Washington, D.C. and meet with policymakers on several occasions. I like doing it because, again, it goes back to the opportunity to share our expertise. I sit with many healthcare policy staffers for different representatives and know that I often know more about the systems and services than those that are designing them. But even beyond that, I think there are opportunities for those of us who aren't interested or able to travel. Sometimes a key decision can be made by a letter to the editor. And those are things that we can and should often do in the middle of the night in those bits and pieces of time that we have to offer information up. So I really think it's an opportunity that we can all think about at different levels to engage on. And so I like to think about advocating at the national level as both those constant communication with our representatives and our elected policymakers, but then also that larger public discussion and how do we engage in it. And sometimes it is around a specific issue. I just happened to be in Washington last week, and we talked about several issues, including continuing the funding for the family-to-family health information centers. But sometimes it's about the bigger pictures and just sharing the perspective of constituents that are facing different issues. I want people to understand that these systems and services matter. A lot of times it's about funding. We all know that healthcare financing, children's special healthcare needs, genetic conditions, and all of the systems and services engaged with them cost money. But it's about putting a story with those dollars that makes it meaningful. And it's about making sure that programs have a bigger picture impact. Next slide, please. So when I think about advocacy at the national level, this toolkit has several resources that are helpful. One that I really like is about using media, because that's a piece that we can all do in small ways. It's often interesting to me that some of the larger impacts around policy that I've had have come up in casual conversations. I've been somewhere at the school pickup, and it turns out that somebody's grandparent is actually someone in a position to make a difference or a change in policy. And so thinking about how we're sharing information at all times and all settings is really important. And I really like the Health Equity Toolkit about policy strategy because it gives us another way of thinking about it. One of the newer things I'm seeing in terms of families having a national effort in policy is how they're using all of the different forms of media that's available to them. Again, some of us are lucky enough to have the opportunity to visit with our policymakers in Washington, D.C. The rest of us actually frequently have the better and more useful opportunity to visit with them when they're in their home districts. We're on a holiday weekend, and I know that it may provide an opportunity to run across people. I luckily, as my daughter likes to say, live in the middle of nowhere in rural Indiana. And it turns out in the middle of nowhere in rural Indiana has many public events, including parades. And I've never met a policymaker or a politician who doesn't enjoy a parade. And so it's those opportunities that have allowed me to build the relationships with our policymakers that allow me to come in and have serious conversations when I want to have an advocacy around a particular issue. So it's those pieces. One of the other things that's been fascinating to watch families change the way we communicate is that now social media can and should be a part of our advocacy story and making sure the issues are happening. And I've seen this happen at all levels, both in the public policy level, so being friends with your congressman on Twitter, and then raising an issue with your private insurance where something's not working on their customer page on Facebook. And so looking at things from all different angles and how we can communicate has allowed me to take my personal experience of parenting my two amazing children who are teaching me every day and building that into something that allows me to change systems and services for the families that follow behind us. And I think that this toolkit is yet another way for more of us to engage in that. I wanted to echo the comment about adding to the toolkit for as you're coming across tools that you're finding helpful to add it, because I think that that will only strengthen this resource.
Great. Well, thank you so much, Rylan, for your story and for sharing so many great resources. And now I'd like to introduce our next speaker, Kim Norris-Grano, who is a family advocate at the Children's Clinic in partnership with Parents Let's Unite for Kids, which is PLUCK, which is located in Montana. Kim, are you there?
I am. Greetings from Big Sky Country. As Sharon said, my name is Kim Norris-Grano, and I'm a family advocate at the Children's Clinic here in Billings, Montana. So I support families in the medical setting for 4 hours a week as a peer. And my role is to connect families to resources that help enrich their lives. So sometimes it's finding recreational opportunities for children with autism, or sometimes it's linking families to respite. Every day is different in the clinic, and I'm so grateful to share what I have learned over the past 12 years parenting my 3 fantastic children, Alana, Sal, and Serena. Next slide, please. Although my official title of family advocate is relatively new, I took on this role at the age of 21. Honestly, I am not sure I really knew what an advocate was back then. I just knew I deeply loved my unborn baby diagnosed with a chromosomal difference, tetrasomy 9p. And as her many challenges presented themselves, like a cleft lip, cleft palate, trach, G-tube, cardiac abnormalities, diverse developmental and intellectual abilities, and on and on and on, my love for her just grew and grew and grew. However, Alana's uniqueness has not always been as readily embraced by others. Some congratulatory cards arrived in the mail following her birth that more resembled sympathy cards. I'm sorry was a common theme. And then there were the comments. What did you do to cause her deformity? What's wrong with her? She's not the way God intended for her to be. Clearly, people did not always know how best to react to her. So I have 12 years of experience explaining the amazing kid that she is. And one way that I help explain her is by reading Alana's story. Next slide, please. So this is a book that I wrote about Alana 5 years ago, and I hope you enjoy it. Hi, my name is Alana. I am 7 years old. My birthday is March 30th. I like to wear a crown and eat ice cream on my birthday. What do you like to do on your birthday? Next slide. Some people call me a baby because I am small. I don't like it when they say that. I am a big girl. I have lost 5 teeth. Do you see where my tooth is missing? Do you have any teeth missing? So I built in questions on many of the pages because I wanted to engage the reader. I wanted the reader to see the similarities that they may share with Alana, and I wanted those common experiences to connect Alana with others. So going on, sometimes kids and grown-ups have questions about me. Some people ask why I have a hole in my neck. Next slide. When I was a baby, a doctor put a tube in my throat. The tube helped me breathe. The hole in my neck is from the old tube. Has a doctor ever helped you? Some people wonder why my nose looks different. When I was a baby, I had a cleft lip. I couldn't blow my nose or eat. So I had an operation. Now I can eat my favorite food, yogurt. What is your favorite food? Next slide. When I eat, I use a big squirter. Sometimes people have questions about that too. I use a big squirter because it's easier than using a spoon. Sometimes I pretend to feed my doll with my big squirter. What do you pretend to do? Some people wonder what I am saying when I use my hands to talk. I know a lot of words in sign language, but I am not deaf. I can hear what you are saying too. Would you like to learn how to talk with your hands? I can teach you. And just to clarify, some of the pictures don't quite match the text, and that's because I didn't get a photo release when I took the pictures for the book, because I created it for personal use. I never thought 5 years later it would be part of a webinar. So kind of a word to the wise. If you're going to write your own story, it's a good idea to get photo releases because you never know where the story is going to appear later on. Next slide, please. I make a lot of sounds with my mouth, too. Sometimes people have a hard time telling if I am making sounds that are happy or sad. One of my happy sounds is a loud scream that sounds like, ah, ah, ah. I usually make this sound when I wash my hands. I love to wash my hands. What do you love to do? I cough a lot and my face turns red. I cough when I cry and I cough when I wake up. People always have questions about my coughing. I am okay. I am not sick, but you can rub my back if you want to. Next slide. You can do other nice things too. Sometimes I don't realize when I have saliva on my chin. If this happens, then you can get me a tissue and remind me to wipe my chin. What do your friends help remind you to do? Some people wonder what I like to do with my friends. Well, I do love to play dress up, but I also like to play basketball. Next slide. I also like other sports like bowling, gymnastics, and even skiing. What is your favorite sport? Of course, I can't always play. I go to school too. Some people wonder what I do in my classroom. Well, it is a lot of fun. I work on my letters, numbers, colors, and shapes. I have art, music, library, and PE. I also get to cook in my classroom, and we take a lot of field trips. What are some of your favorite things to do at school? Next slide. Sometimes people don't know what to think of me when they first meet me. I am different from other kids, but different is good. And I am a great friend once you get to know me. What makes you different? This book answers a lot of questions. Questions are good. Everybody learns by asking questions. If you have more questions about me, then please ask my mom or my teacher. And so I really wanted to touch on the fact that questions are okay when I wrote this book, because I have overheard children asking questions to their parents, and the parent will quickly shh the child, saying, don't ask questions, that's rude. And so I wanted this book to address some of those elephants in the room. Yes, Alana looks different, and we can talk about it. We can feel comfortable about it. I believe a desire to understand Alana is not rude. In fact, it's vital to her living in an inclusive society. So I like to validate a child's comment. And I'll say, yes, her nose looks different. There are lots of noses, big noses, small noses, crooked noses, long noses, and Alana has a one-of-a-kind nose. Next slide, please. So this story was written for children, but it has been used with Alana's grandmas, grandpas, aunts, uncles, teachers, therapists, family support specialists, child care providers, on and on and on. I found that sometimes adults need as much or more help understanding her individuality. On a very personal level, I met my husband when Alana was 7. We met quickly, and we eloped before his family was able to meet me or Alana. And my husband's parents were quite concerned that he had bitten off more than he could chew. So I sent Alana's story to them, and instantly they couldn't wait to meet their new granddaughter. For them, the book really tore down some stereotypes, and it was really quite magical. The story has also been used with Alana's cousins, classmates, children in her after-school programs, and it always helps start necessary conversation that leads to Alana being better understood, accepted, respected, and included. Next slide, please. So Alana's story can be found on this site. And the idea is that families can use this as a template or an inspiration for their own stories. I created Alana's story after reading another story that was created by a mom to talk about her daughter. And one nice thing about writing a book is that I can give it to others to share for me. For example, Alana's teacher can read it with new peer buddies in the classroom, and I don't always have to be there to facilitate that understanding. Coaches, camp counselors, other people besides myself can share this story with other children. Next slide. So there are many resources for communicating about your health. And so here are a few more links from Parent to Parent of Vermont, the Genetics Collaborative, and the Institute for Child Health Policy at the University of Florida. And this is my family, and we are at the pumpkin patch. Alana's right in the middle there. And then Sal is my 3-year-old, and Serena's the little baby. Next slide, please. Here are some more resources. Family Voices has some resources, also the Research and Training Center on the Community Living at the University of Minnesota also has stories about the importance of sharing your story. Next slide, please. So lessons learned so far. In situations with Alana, I have found that every question is an opportunity to advocate. However, I seldom give the same answer to similar questions because people ask questions for different reasons. So before answering a question, I inquire first with a genuine smile, and then I say, just curious, why do you ask? And then I tailor my response to best fit the situation. And I'm always amazed at the different responses to my question, just curious, why do you ask? Once a woman in probably her 80s or 90s asked me, does your daughter have cerebral palsy? I responded, no, but just curious, why do you ask? And she went on to tell me about her daughter, who's in her 60s, who has cerebral palsy. And she told me how she was forced to institutionalize her when she was about 8 years old, and that now she lived in a group home an hour away. And we exchanged phone numbers, and I told her to call me if she ever wanted to visit her daughter, as I would happily drive. I figure what goes around comes around, and I might want a ride to visit my daughter someday. But other people are curious about Alana, maybe because a baby was just born in their family with diverse needs. So my responses to questions get as detailed as they need to be. My favorite response to what is her diagnosis is, well, her primary diagnosis is being one heck of a cute kid. Because although I have a lot of experience communicating about Alana's health, I don't share with others the nitty-gritty details unless there is a need to know. That's why I like to use the question, just curious, why do you ask? Something else that I've learned is that I teach others how to feel about Alana. If I am okay with her, then they are okay too. So I always remain aware of this fact when she's trying my patience in public. People look to me to figure out how they should respond to her behaviors. So most times I am communicating to these perfect strangers by smiling, remaining calm, and having a sense of humor in the face of challenging situations. I guess I touch on this because communicating about Alana and her needs is not always something I do verbally. It happens non-verbally too, with people I am completely unaware of. Hopefully all this makes sense. But finally, I want to touch on the fact that I'm always amazed at the things people don't know about Alana, especially when they have known her for years. So I have learned to not assume people know what I think they should know. Just the other day, my girlfriend since high school said to me, Alana has a chromosomal difference, right? Well, what in the heck does that really mean? And she's a 35-year-old college-educated engineer. So if she doesn't know what a chromosome difference is, then I'll bet Alana's great aunt doesn't really know either. So I try to remember that there is almost always opportunity for additional awareness. So thank you for listening, and I hope if you have any questions, you'll type them in on the chat box.
Great. Thank you so much, Kim, for sharing your story. I think the template is definitely a resource, and I'm so happy you were able to talk about why you created it and how others can use it, as well as some of the other resources. So thank you very much. And now I'd like to pass it over to Kathy Brill, who's the Executive Director of Parent to Parent USA, and then Bev Baker, who's the Co-Director of the National Center for Family Professional Partnerships at Family Voices, and they'll share a little bit about some additional resources. Kathy?
Okay, thank you so much. Those presentations were wonderful. I appreciate that so much for sharing. Parent to Parent USA's vision is for all children with disabilities and special health care needs to grow up in a family who supports them to lead full and happy lives in their communities. And of course, as our wonderful speakers have just shared, in order to make that happen, many times advocacy needs to first happen, as the barriers present often prevent us from attaining our goals and visions. So together, Parent to Parent USA, Family Voices, and the Genetic Alliance compiled this ATLAS toolkit. So parents, advocates, and self-advocates can find the process of advocating for a cause to hopefully be much less stressful and much more empowering. Parent to Parent USA believes immensely in the strength and resiliency of parents, and having effective advocacy tools at their disposal for whatever topic, issue, or challenge presents itself further strengthens those qualities. Next slide, please. So we have a couple of basics. The one, primary one, is that parent-to-parent support, as promoted by Parent to Parent USA, is the intentional matching of an experienced, prepared support parent with a parent seeking peer support. So this is an opportunity to connect with others who have already advocated for the same issue as you might be going through right now, and you wish to find an ally who has already done some of these things. Our alliance members are statewide organizations that provide this support and information to families with children who have special health care needs or disabilities, most notably through parent-to-parent support. Next slide, please. So if you want to connect or collaborate with an existing Parent-to-Parent Alliance member, you can go to our website and find a lot more information. If you want to see the national map and find your state, click on Looking for Support, click on your state, and you'll find all the contact information for your parent-to-parent. If you happen to be in a state that does not have a parent-to-parent organization and you know of somebody who might be interested in starting one, give me a call for that as well. If you want to contact me for any reason whatsoever, my information is right there as well as on the website. So thank you very much. Next slide, Bev.
Thank you, Kathy. Hello, everyone. Thank you for joining us today for the webinar. My name is Bev Baker, and as Sharon said, I work for Family Voices as the co-director for the National Center for Family Professional Partnership. And I've been partnering with the Genetic Alliance and Parent to Parent to develop the ATLAS toolkit that you're learning about today. So a little bit about us. Family Voices is a national family-run nonprofit organization. We were founded in 1992 by families who were raising children and youth with special health care needs. And the purpose of which, in founding this organization, was to to activate family roles in health care. The mission of Family Voices, to achieve family-centered care for all children and youth with special health care needs and or disabilities, is all about helping families to be better advocates for their child. So this work in creating the toolkit was a natural fit. Next slide, please. Through our work, we do a variety of things, and here are some bullet points indicating some of the major focuses. We provide families with tools to make informed decisions. We encourage self-advocacy and work with youth and young people with disabilities in empowerment and self-advocacy activities. We build partnerships among families and professionals. We advocate for improved public and private policies, and we serve as a trusted resource on health care. Next slide, please. For the past 8 years, Family Voices has been the recipient of funding from Maternal and Child Health to run the National Center for Family Professional Partnership, known as the NCFPP. The National Center is dedicated to MCHP outcome measure. Families will partner in healthcare decision-making. So Family Voices created this concept and pushed for funding for these family-to-family health information centers. These are funded centers in every state and DC that work with families in their state to improve policies that affect families and children, and to provide support directly to families and children as well. Our work under the National Center is focused on providing support to these centers. We do this by providing peer mentoring, support, training, technical assistance to these family leaders in every state. We promote partnerships between family and professionals, and one of our roles at the National Center is to connect the state's with one another in order to facilitate that sharing of resources. So many of the tools in this toolkit came from these networks of family leaders, both from the Family to Families and from the parent-to-parent organizations around the country. So to learn more about our organization, please visit the websites on this slide. We actually have 4 websites now, and I want to highlight one of them that we don't have listed here, but I can show you later, is the, here it is, sorry, it's on the last slide, the Impact website. So Impact is one of Family Voices projects focused on health and wellness issues for all families and children. And this, this website has recently been redone and is quite spectacular, so take a look at that. Our CASA website also shown here, that's Kids as Self-Advocates, focused on youth and young adult issues, and then of course the Family Voices and the NCFPP website. So we're so pleased with the opportunity to share the results of this work and hope that you find this tool helpful in the work that you do. So please share ideas and resources to continue improving it, and we look forward to hearing from you. Thanks for joining today. And I'll turn it over to Sharon to do the wrap-up.
Great. Well, thank you so much. We actually have some time for questions, so and for anyone out there, if you could send in any questions you may have using the chat box feature, that would be great. And then we have a few questions to get started. So the first question is, I guess for all of our presenters today, how much time does this all take? Meaning advocacy, getting involved as a leader, etc. Rylan, do you want to answer that? Go ahead.
I'll start. Can you hear me?
Yes, thank you.
I think that the really nice answer is that it can take very little time or a whole lot of time. It really depends on what works for you and your family. You know, meaningful advocacy can come from one conversation and one contact, but I think that a lot of families learn quickly that the more opportunities we have to practice these skills, the better our outcomes are and the greater our ability is to make a difference. So it absolutely can be one email sent or one phone conversation or one quick conversation, but it can also be lots of little conversations like that over time that build relationships that allow us to be really powerful in our advocacy. So I think the opportunity exists for anyone in the way that it makes sense for you and what you're comfortable with and how you can build and grow from there.
Great. Do any of the other presenters want to build on that?
No, I'd just like to add, this is Kathy, that I totally agree with Rylan. I've been doing this now for 24 years as a mom, and I wasn't always able to put in the amount of time I do now. In the beginning, I just took it in bits and pieces and little snippets wherever I could find time, similar to what Rylan had stated. And that is okay. That is perfectly fine. Because as your life changes, as you find more time, you can build up into doing more if you choose to. But every little bit helps, and the other thing that you're doing by staying involved like that and getting involved is you are showing that you are very interested in making this impact, making these changes happen, and to advocate. And people notice that. They don't necessarily notice whether you spent 12 days on an issue or 12 minutes on an issue. You're still having an impact.
And I will say that the more times you have opportunities to do it, the greater opportunities that are available to you. So if you're engaged, things happen, and there might be some ways to get some funding or some support to do some advocacy. So that's not always a possibility and it's not always necessary, but standing up and being willing to take on that role definitely leads to additional opportunities.
And this is Bev. I just want to, I agree with what the other presenters have said, and just want to add one piece is that when, oftentimes it's true when our kids are young, we have very little time, and we have to pick and choose what what we're going to work on and what we have to let go. So I remember being very conscious of that when my son was young, that I would sometimes just have to let something go or give it to somebody else and let them take it on. And then as things changed in my life, I did have more time, so I've been able to pick up a great deal more and also help other family members. So it's another, other families rather. So it's another thing to remember that that sometimes when you can't do it, there may be somebody else who can help you. And so just reach out and ask other people for support.
Right, and then just to piggyback on that, when you connect, you can connect with others that have those exact same desires for those same advocacy efforts, and you can divide up the work so it doesn't all land on one person's plate.
Great, and this is Sharon Ermelchuk from Genetic Alliance. I also just wanted to point out on your screen, you can see we did mention this as part of a 3-part series, and the past 2 webinars have really pointed out some additional resources that would be helpful for people looking to get involved as a new parent who wants to get involved in advocacy. So I encourage you to check both of those out, and then as well as review the resources on the site. So thank you. So
there are fantastic resources on the site. So if you haven't taken the opportunity to really go through all of the categories, please take some time to do that. And it will continue to grow. So that's why, like Sharon had said in the beginning, it's very important that you give us feedback and continue to provide us with additional material to be vetted and added then to this site.
Yeah. Thank you very much. Our next question is, how does your advocacy work interface with self-advocacy efforts by people with disabilities or genetic issues? Kathy or Bev, do you want to answer that?
Would you repeat the question?
Sure. How does your advocacy work interface with self-advocacy efforts by people with disabilities or genetic issues?
Well, how I see it as really, it is really one and the same when you think about it. I try to learn as much as I can from my daughter, who then kind of like, we kind of push together on the same topic. As I see a need, then I can get more involved in that advocacy, and that's kind of what I heard the 2 presenters say as well. You know, we learn what the needs are, and then we go out and we do them. And our children are the future self-advocates. They may be children at one age, but they grow up really fast. The other thing that's extremely important, and something that becomes even more important the longer I'm in this field, is the need to connect with self-advocates at an early age. So when you're a young parent, connecting with the self-advocacy movement is a huge boon for you. You might not see the relevance right away because you're so caught up into what your own issues might be for your child, but you'll soon see that they are out there fighting for the exact same things that you're fighting for your child, and you can work hand in hand to make systems move at a much greater pace. And also getting your child involved with the self-advocacy movement as soon as possible, so that they can learn how to do advocacy on their own.
So this is Deb. Yep. You go ahead, Rylan.
I wanted to jump in because I think one of the real truths in my life is that my opportunity to get to know the adult self-advocate community has made me a better parent, and it's really impacted my children's lives for the better. It's allowed me to look at the big picture in terms of self-determination and what some of the issues are. And recently, you know, I really had to take a moment last year, actually, and had yet another lesson from the adult self-advocacy community, and it was around the ratification of the Disability Rights Treaty that actually is still in front of the Senate. And last year when they were getting ready to vote on it, it wasn't really on the top of my priority advocacy list. It was on there, but it wasn't on the top. And when I was engaging with other adult self-advocates, they really explained to me that this was about human rights and being able to stand up for that. And they really, you know, gave me an eye-opening experience that I absolutely deserved, that if we couldn't start with the foundation of human rights, then my issues around Medicaid weren't as important. And so I think that I'm always learning and growing from being partners with adult self-advocates around policy issues on the national level and at the state level, and then at the personal level. It really helps me to be critically thinking about the opportunities that I'm giving my own children and making sure that I am respecting their individuality.
Excellent.
Wonderful. Also, you'll notice the tools in the toolkit, they are can be used by everyone. So they're not just for families. They're not just for, one strand or another. They're categorized, yes, but they truly have been gathered from all sorts of, whether it be self-advocacy or family organizations. So that's just very important to keep in mind as well.
Thank you, Ryla and Kathy. This is Bev. I just had one more perspective to add here. So I had the advantage of actually starting in the adult world before I was a parent of a child with a disability or special health care need. And so I had learned a lot of lessons from the adults that I'd worked with prior to being in this role as a parent. And what's interesting now for me is my child is now a young adult, and so we're moving into that next, we've moved into that next phase. And I keep sort of learning over and over again that until you experience something yourself, it's hard to know what it's like. So I remember as a young woman working with families of adult children and not understanding why they didn't see things the way I did, or why they didn't understand the importance of this person's independence and various issues. I mean, so anyway, my point about all that is that now, being on the other end of that, I understand exactly what many of the struggles are as you're working with your child to enter that adult world. So it does help to understand the perspective of self-advocates, and is also to understand what it's like to be a parent and how those two actually do conflict at times and how you can work together.
And this is Sharon from Genetic Alliance. I wanted to echo that statement. Part of the mission of the National Genetics Education and Consumer Network is around engaging consumers within genetics programs. We really believe that the perspective that both self-advocates and parents can bring to these programs and designing programs to meet their needs is invaluable, and we will continue to promote the advocacy and engagement of consumers in our programs. So thanks for that question. We have one more question. The question is, you've presented a number of national resources, and coming from living in Ohio, I'm wondering if you could point out how to find resources specific to my state.
Am I off mute? This is Bev.
Yes.
Yes. So one way to do that is to contact the local parent-to-parent in your state or the family-to-family. Those are two organizations that can help you locate your local organizations. And then, Sharon, would there be also, could you guide people toward the Genetic Alliance, the local Genetic Alliance groups?
We do feature some state-specific information on many of our sites, and we typically would link to the family health information centers and where to find providers in your state. So I encourage you to check out our sites if you're looking for resources such as Baby's First Test, if you're looking for resources on newborn screening, or genesinlife.org if you're looking for information on genetic tests, those types of things. So we do feature some state resources, yes.
And I think both Kathy's Parent-to-Parent and our Family Voices website has resources. It can connect you to the state resources. So on the Family Voices site, there's a map that comes up, and you can go to Ohio, I think you said you were from, this caller was from, and click on that and get some information about how to reach the local organization who can steer you toward the resources that you're interested in.
Right now,
I also want to encourage you to check out the pages of your Regional Genetics Collaborative. They also feature resources specific to their state. So these are programs that are funded by HRSA around improving access to genetic services and the quality of those services. And they have a number of programs in the states and region-wide that may be helpful for you. And you can also find resources on our National Coordinating Center's website, which is run by the American College of Medical Genetics. And that website is www.nccrg.org. They have a number of resources for families as well and can connect you to those state and region programs.
And you also have your DD Council. Oftentimes the statewide DD Council will put a lot of state-specific resources on their sites.
Great.
I think it's also just a really great question because it recognizes the fact that there are many issues that are different from state to state. While we all have access to Medicaid, each state's Medicaid program is different. So by asking the question, you're already sort of ahead of the game in knowing that you do need to look at things both from a national perspective and then in your local community, and that provides a lot of opportunities to get connected in a variety of ways.
Thank you so much for pointing that out, Rylan. I think this webinar has been a great way to connect people with resources as well as connect us from different networks around this common goal of providing individuals with resources and empowering around this idea of advocacy. So I think this is a good place to end. We'd like to thank you for your participation for today. If you do have additional questions, please do either enter them in your survey after the webinar, or you can feel free to email them to me, as well as follow up with any of the presenters from today. We hope you're excited about the Advocacy Atlas, and we do invite you to visit the site and continue to send us feedback on how the site could be improved, and if you have additional resources you think should be added. And I hope that everyone has a great rest of the week and a happy holiday. So thank you so much for your participation.
Thank you.
Thank you. Bye.